presenting, and group 3, we are 6 members. There is Beatrice Njama, we have Viola Chech, we have Cherono Karen, we have Valerie, Yvette Vivian, and Lily Dorcas. So we'll be tackling outpatient severe acute malnutrition. So basically most of the times we are told that you cannot manage severe acute malnutrition in the community or in the outpatient, but you can. The only part that you do not, for those children who are below 6 months, if you diagnose that patient to have SAM and the baby is below 6 months, that is, you refer to inpatient. But you can also manage SAM in the outpatient department, and the first thing that you do if they come, you do assessments, the A, B, C, D, E, F, and then you also, in this, you also ask about, you want to inquire. You have done the assessment, you have seen that this person is has severe acute malnutrition, but you have to ask about the weight loss. How long have it been in the previous week or the previous month? Then you also have to ask about the appetite of this baby or the 6 months and above patient. And also, for those who are breastfeeding still, because if they have to breastfeed up to 2 years, you also ask the mother, if it's the mother who has brought the kid, if the baby is still breastfeeding. Are we together? Then you go to look and feel. So in the look and feel, this is where now you apply the work. You take the work measurements because you want to, so that you can be able to now go to the next one to classify. So the mark of a patient who is SAM, for those who are below 6 months, it should, and also up to 2 years. If it is below -3, the score is below -3. This person is SAM. Then you go to classify. You classify now, depending, now you have already determined that this person is SAM, but now any other underlying condition, is it there? Now this is where also you collect that data, so that now you know, because those patients that are SAM and they are above 6 months, we have said you can have them in the outpatient, but if they have an underlying condition, you refer them to inpatient. Then you go to, then finally you go to the intervention. How do you intervene? Intervention, number 1, you have to conduct an appetite test. How do you conduct an appetite test? You have to find a quiet room. The caretaker of that child should be in that room, and then also the child should be in that room, and yourself as a nutritionist. You inform the caretaker what you are doing. You show him or her the RUTF, and then now you explain to the caretaker how to give this root, because you're not the one who is supposed to give that to him or to the baby. So, number 1, also advise the caretaker to clean or wash their hands properly, and then now advise them to use a cup when giving, as from a cup and a spoon, or through using their finger to feed the baby. So, how do you know that this patient has passed the appetite test? How? Someone can tell me. How do you know that the child has passed the appetite test? Yes, beyond. So you know if the child has passed the appetite test if the person or the child at least takes the minimum amount regarding to the weight of that child. So we have, if that person is below 4 kgs, he or she could take an 8 to a quarter. That's out of the back of the sachet. Then 4 to 6.9 quarter to a third. Then we have 7 to 9.9 kgs, a third to a half. 10